Yeah, so this is kind of embarrassing, but I've been experiencing episodes of HERP, and I've been feeling burning sensations frequently. A friend of mine told me about monolaurin, and I also heard about it on Dr. Oz. And I was wondering if there's anything you could tell me about monolaurin or herpes that I don't already know.
Sure. First of all, I'm sorry to hear about your current condition. Before we get into the discussion of monolaurin, I'd like to talk to you a little bit about the virus itself, just so you know what more is going on in your body.
Oh, is that what that is back there?
Yeah, actually, this is a diagram of the herpes virus. The virus itself is actually a small infectious agent. It contains the necessary equipment to replicate on its own, but it does require a human host, such as yourself, to complete replication. Um, there's two serotypes of the virus, HSV1 and HSV2. HSV1 is where we see mostly the cold sores, and you likely have the second serotype, which causes the genitourinary lesions. They're both a part of the human herpes virus family known as Herpetoviridea, and basically, once the virus has injected its DNA into the cell, it can establish a lysogenic cycle where it's permanently established within the chromosome. Under certain conditions, it can undergo the lytic cycle, which is where the virus replicates DNA and proteins, and then you experience outbreaks of the lesions.
That's cool and all, but how do I stop the burning sensations? And what's with this monolaurin?
Okay.
Well, I'm glad you asked about the monolaurin. Generally, the standard of care is antiviral drugs such as acyclovir, but for a more natural remedy, people tend to try to use monolaurin. It's a monoglyceride derivative of lauric acid, which can be found in coconut and human milk, but typically it's commercially used as a surfactant. Some people use it for colds, shingles, and other viruses such as herpes in this condition. It's thought to have some antiviral activity and can help to boost the immune system by T-cell growth.
Okay, so would you recommend monolaurin for me?
As far as my recommendation, even though it does have some antiviral action, the safety and efficacy profiles have not been well established. There are some more preferred therapies, such as the acyclovir, like I mentioned earlier, and valacyclovir. I would recommend that you go get a prescription from your doctor. That's going to optimize your therapy, help to make sure that the outbreaks aren't as severe, and to prevent them from transmitting them from other people.
Okay, so I should probably just get a prescription for acyclovir from my physician?
Absolutely.
All right. Thank you for your help. Hopefully it works.
Thank you.